Imagine carrying a heavy backpack of past experiences, feelings, and memories that just won't lighten up. This weight can make daily life feel overwhelming, especially when it involves something like post-traumatic stress disorder. What if there was a way to unpack some of that burden and feel a little lighter? The good news is, yes, eye movement desensitization and reprocessing therapy, or EMDR, has shown significant effectiveness in reducing post-traumatic stress disorder symptoms for many people. It is recognized as a leading evidence-based treatment for trauma globally. To understand how EMDR helps, let us consider how traumatic memories are typically stored. When a highly distressing event occurs, our brain's natural processing system can sometimes be overwhelmed. This can lead to the memory being stored in a raw and processed way, complete with vivid images, intense emotions, and uncomfortable physical sensations. These unprocessed memories can then easily be triggered, causing flashbacks, nightmares, and strong anxiety, making it feel like the past is happening right now. EMDR therapy helps your brain reprocess these distressing memories by using bilateral stimulation, which often involves guided movements. As you focus on the troubling memory and simultaneously engage in this left-right stimulation, it is thought to mimic what happens naturally during rapid eye movement sleep. This process allows your brain to integrate and store the traumatic memories in a more adaptive and less disturbing way. It is not about erasing the memory, but about changing its emotional charge and impact, allowing your brain to complete its natural healing process. During an EMDR session, a trained therapist will guide you through specific phases, beginning with establishing safety and coping skills. You will then be asked to identify a distressing memory and the negative beliefs and feelings associated with it. While focusing on this memory, you will engage in the bilateral stimulation, such as following the therapist's hand movements, listening to alternating auditory tones, or holding handheld buzzers that gently vibrate. Your therapist will regularly check in with you to monitor your experience and progress, ensuring a supportive and controlled environment. One of the unique advantages of EMDR is that you do not always need to verbally describe your trauma in extensive detail, which can be a significant relief for many individuals. The focus is more on what you are experiencing internally, including feelings, beliefs, and body sensations. This aspect can make it less intimidating than traditional talk therapies for some. Furthermore, leading health organizations like the World Health Organization endorse EMDR as an effective treatment for post-traumatic stress disorder, underscoring its clinical credibility. Ultimately, by enabling your brain to reprocess and integrate these challenging experiences, EMDR therapy can profoundly transform how those memories impact your present life. The goal is to significantly reduce the intensity and frequency of distressing symptoms like flashbacks, nightmares, and hypervigilance. This often leads to a greater sense of calm, improved sleep, and the ability to engage more fully in daily activities. Many individuals who complete EMDR report a renewed sense of control, inner peace, and a more hopeful outlook for their future, allowing them to move forward from trauma with resilience.